Tired of dialysis and planning to go for a kidney transplant soon? Well, you must be having many doubts in your mind. And that's why in our today's video, Senior Consultant Urologist Dr. Sandeep Harkar will tell you everything you need to know before going for a transplant.
Kidney diseases have become very common these days, and kidney transplant is something which can transform the life of a patient who has kidney problems and is on dialysis. I am Dr. Sandeep Harkar. I am a senior consultant urologist and kidney transplant surgeon in the Department of Urology at Artemis Hospital, Gurgaon. So I shall be discussing with you regarding kidney transplant today. Kidney transplant is a surgery in which a kidney from a healthy donor or from a cadaveric donor is placed inside a person whose kidneys have failed. That means a person whose kidneys have almost decreased to 90% less of their normal functionality, which is called as end-stage renal disease. So these are the people who are either on dialysis for their kidney failure or who are about to go on dialysis. So these are the patients in which we do a surgery and we place the kidney which is taken from a healthy donor and is transplanted, is surgically placed inside the body of these ill-fated patients to give them a new lease of life. New kidney which is used for kidney transplant comes from either a healthy donor who is a close relative of the patient in which the transplant is being done. So normally every person has two kidneys, and a healthy person can donate one of the kidneys. That is one of the sources of the kidneys which is used for transplant. The other source is cadaveric transplant. That means a person who is brain dead, who doesn't have any chance of recovery, but his body organs are functioning well, the kidneys are functioning well. So in those cases, if these brain dead patients or their close relatives pledge the kidneys, these organs, these kidneys can be used for transplantation. So basically there are two sources: a healthy living donor or a cadaveric transplant. There are two types of kidney transplant. One is living donor transplant, in which the kidney from a living donor is removed, one of his kidneys is removed, and it is transplanted into a recipient who is a case of kidney failure. So other is a deceased donor transplant, in which a person who has because of any unfortunate incident like a trauma or a stroke or any other condition has become brain dead. In those people, the kidneys is taken out from that person because he anyways doesn't have any salvageability. So this kidney is used as transplant for the recipient. So this is called as deceased or cadaveric renal transplant. So in all, there are two types of renal transplants. There are immense benefits of kidney transplant. A person who is an end-stage renal disease, that means who has got chronic renal failure, they have to live their whole life on dialysis. Now, after a kidney transplant, he does not need dialysis any further. His appetite, his energy levels become much better. His growth becomes better, especially in case of children. Their growth is well maintained. Now, these patients also, their fertility and their sexual life also improves. In addition, there are fewer restrictions on diet also in this case. So overall, their quality of life gets a sea change. So there is no particular age group in which it is to be done. It can be done in a very early age group. We have done transplants in children also, and it can be done at an advanced age also. So for kidney transplant, there is a process which has to be followed very sincerely. Regarding testing, evaluation, there is donor evaluation as well as a recipient evaluation. The recipient means the person in which the kidney has to be placed, and donor is a person who is donating the kidney. So for any surgeon, donor health is most important. We cannot compromise with the health of a donor. So when a person approaches for kidney donation, he has to be assessed from the point of view of his fitness for being a donor. That means his kidney evaluation is done to see the function of the kidney, and especially when the kidney is removed, does he have enough reserve in his body to not affect his life? That is the most important thing. So donor evaluation is done for his fitness, for his condition to donate a kidney, and also from his anesthesia point of things. And similarly, for the recipient, his fitness for surgery is evaluated, and we have to get all other matchings done so that the kidney which has to be transplanted, it matches very well with the recipient, and there is no mismatch or rejection. So regarding how kidney transplant is done, it's a surgery in which the kidney is removed from the donor. He undergoes a surgery which is usually done laparoscopically, in which the kidney is removed by a laparoscopic surgery. We choose the kidney which is to be removed, either right or the left, and accordingly it is taken out from the patient and donor, and subsequently the same kidney is transplanted into a recipient. The average duration of surgery in a donor is about 2.5 hours, and similarly in the recipient it's little longer, maybe 1 hour more. So this is the average duration of surgery. An interesting question asked by many people is that what happens to the old kidneys, the native kidneys? Do you remove the native kidneys of the patient and then place a new kidney there? No. Normally, the kidneys which are there in a patient of chronic renal disease, they're already shrunken. They are smaller in size. So you don't do anything to those kidneys, and this new kidney which is to be transplanted is placed at a different place inside the abdomen of the patient. And it is actually a third kidney that he continues to have. But over a period of time, the original kidneys, native kidneys, since they are already not functioning, they start shrinking and shrinking gradually. So this is how it happens. And there are some cases, very rare, where the native kidneys are too large, because the condition causes adult polycystic kidney disease, in which the kidneys become too big and there is no space to put a new kidney. So in these cases, we have to remove the native kidney of the patient and create space for the new kidney. Or there may be cases where native kidneys are infected. In them also, we have to remove the native kidneys, the original kidneys, and place the new kidney at a different place. Dear friends, it's very unfortunate that still we don't have adequate information about the kidney transplant in our country, and we have such a huge burden of people who have kidney damage and who are on dialysis, and if they get transplant, if they get kidneys, donor kidneys, their problem will be solved forever. So we do not have a very good cadaveric donor program available. A lot of people do not pledge their kidneys, and if actually we all take a step and pledge our kidneys in case of any unfortunate event happening to us, then we can do a lot of good to the society. So there are some risks also of kidney transplant surgery. Like any other surgery, kidney transplant surgery also may have complications like bleeding, like infection, prolonged hospital stay. In addition, there may be a need for strong medications after the surgery, because if you understand, a foreign body, a kidney from some other person, is to be placed inside the recipient, and so body reacts. So we have to suppress the immune system of the person. For this, he'll need medicines for a long time to control the immune system, which itself can lead to further infections. So that is the risk. In addition, In some people, some further surgeries may be needed in order to fix any problem arising over a period of time. There may be cases where kidney transplant doesn't work. The transplanted kidney, despite taking all the precautions, all the matching is done, it may not work. In that case, we may have to remove the transplanted kidney also. Also, the original disease which has caused damage to the native kidney of the patient, which is the patient's own kidneys have got damaged. So the same disease may affect the transplant kidney also over a period of time. So these are the risk factors, risks associated with kidney transplant. So I hope I have been able to clarify your doubts about the kidney transplant procedure. And if you have any further queries, you can just drop them in the comment box and I'll try to answer them as soon as possible. And if you liked my video, please like, share it further and subscribe to our channel. Thank you.